Candidiasis is a common infection caused by a type of fungus called Candida. Candida is a yeast-like fungus that naturally exists in and on our bodies. It usually doesn't cause any problems. However, when Candida grows too much, it can lead to an infection called candidiasis. Candidiasis can affect various parts of the body, including the mouth, skin, genitals, and even internal organs in severe cases. Different types of candidiasis exist, each with its own set of symptoms and treatment approaches. One common type is oral thrush, affecting the mouth. Another prevalent type is vaginal yeast infections, affecting the vagina. Understanding the different types of candidiasis, their symptoms, and available treatments is crucial for effectively managing and preventing these infections. Recognizing the signs of candidiasis and seeking prompt medical attention is essential for timely and effective treatment. By being aware of the causes, symptoms, and preventive measures, individuals can take proactive steps to maintain their health and well-being. Candidiasis manifests differently depending on the affected area. Recognizing these symptoms is crucial for early detection and treatment. Oral thrush, a common form of candidiasis, presents with creamy white patches on the tongue, inner cheeks, and sometimes the roof of the mouth, gums, and tonsils. These patches may be slightly raised and resemble cottage cheese. They can be painful and may bleed slightly when scraped. Vaginal yeast infections typically cause intense itching and soreness in the vaginal area. A thick white and odorless discharge, often described as resembling cottage cheese, is another common symptom. Pain or discomfort during urination and sexual intercourse can also occur. Skin candidiasis often appears in warm, moist areas of the body, such as the armpits, groin, and under the breasts. It manifests as red, itchy rashes with small, pus-filled bumps. The affected skin may also become cracked and painful. Invasive candidiasis, a more serious form of the infection, occurs when Candida enters the bloodstream and spreads to internal organs. This type can cause fever, chills, and other flu-like symptoms. The symptoms of invasive candidiasis can vary depending on the affected organ. Candidiasis develops when an overgrowth of the Candida fungus occurs, disrupting the body's natural balance. Several factors can contribute to this overgrowth, increasing the risk of developing an infection. A weakened immune system is a significant risk factor. Conditions like HIV, AIDS, cancer, and diabetes can suppress the immune system, making it easier for Candida to multiply unchecked. Certain medications such as antibiotics, corticosteroids, and chemotherapy drugs can also suppress the immune system. Hormonal changes, particularly in women, can increase the risk of candidiasis. Pregnancy, menstruation, and the use of hormonal contraceptives like birth control pills can alter hormone levels, creating an environment favorable for Candida growth. Certain lifestyle factors can also contribute to candidiasis. Wearing tight-fitting, non-breathable clothing, especially underwear made of synthetic fabrics, can trap moisture and create a warm, humid environment conducive to fungal growth. Prolonged exposure to moisture, such as from sweating or wearing wet swimsuits, can also increase the risk. Certain medical conditions such as diabetes can increase the risk of candidiasis. Diabetes can elevate blood sugar levels, providing a more suitable environment for Candida to thrive. Treating candidiasis typically involves antifungal medications that target and eliminate the overgrowth of Candida. The specific treatment approach depends on the type and severity of the infection. For mild cases of oral thrush, over-the-counter antifungal lozenges, mouthwashes, or topical creams containing clotrimazole or meconazole are often effective. These medications work by directly targeting the Candida fungus in the mouth. Vaginal yeast infections are commonly treated with antifungal medications available in various forms, including creams, ointments, suppositories, and oral tablets. Clotrimazole, meconazole, and tioconazole are common antifungal agents used for vaginal infections. Skin candidiasis is typically treated with topical antifungal creams, ointments, or powders. These medications are applied directly to the affected skin areas. Common antifungal agents used for skin infections include clotrimazole, miconazole, and ketoconazole. Invasive candidiasis, a more serious form of the infection, requires systemic antifungal treatment. This typically involves intravenous antifungal medications such as fluconazole or amphotericin B administered in a hospital setting. Section 5. Preventing candidiasis, practical tips for everyday life. Preventing candidiasis involves adopting healthy habits and lifestyle modifications that minimize the risk of candida overgrowth. While it may not be possible to completely eliminate the risk, these measures can significantly reduce the likelihood of developing an infection. Maintaining good personal hygiene is crucial. This includes showering or bathing daily, especially after exercising or sweating, and keeping the affected areas clean and dry. Wearing clean, breathable clothing, particularly underwear made of cotton, can help prevent moisture buildup. A healthy diet plays a role in preventing candidiasis. Limiting sugary foods and drinks can help control blood sugar levels and reduce the availability of simple sugars that candida thrives on. Incorporating yogurt with live and active cultures or taking probiotic supplements may help restore the balance of beneficial bacteria in the gut. Managing underlying medical conditions, such as diabetes, is essential. Properly controlling blood sugar levels through medication, diet, and exercise can create an environment less favorable for candida overgrowth. If you have a weakened immune system, talk to your doctor about ways to boost your immunity. This may include taking medications or making lifestyle changes. Section 6. Oral thrush. A closer look at candidiasis in the mouth. Oral thrush, also known as oral candidiasis, is a fungal infection that affects the mucous membranes of the mouth. It is characterized by creamy white patches on the tongue, inner cheeks, and sometimes the roof of the mouth, gums, and tonsils. Several factors can increase the risk of developing oral thrush, including a weakened immune system, certain medications, uncontrolled diabetes, poor oral hygiene, and smoking. Infants and older adults are also more susceptible to oral thrush. Treatment for oral thrush typically involves antifungal medications, which are available in various forms, such as lozenges, mouthwashes, and topical gels. These medications work by directly targeting the candida fungus in the mouth. Maintaining good oral hygiene, such as brushing twice a day and flossing daily, is essential in preventing oral thrush. If you experience persistent white patches in your mouth, pain or discomfort, difficulty swallowing, or redness and cracking at the corners of your mouth, it is essential to consult a doctor or dentist for proper diagnosis and treatment. Early diagnosis and treatment can help prevent complications and improve oral health. Section 7. Vaginal yeast infections. Understanding and managing a common condition. Vaginal yeast infections, also known as vaginal candidiasis, are a common fungal infection that affects the vagina and surrounding tissues. They occur when there is an overgrowth of candida fungus in the vagina, disrupting the natural balance of microorganisms. Vaginal yeast infections are characterized by intense itching and soreness in the vaginal area, a thick, white, and odorless discharge, often described as resembling cottage cheese, and pain or discomfort during urination and sexual intercourse. Several factors can contribute to the development of vaginal yeast infections. Treatment for vaginal yeast infections typically involves antifungal medications, which are available over the counter or by prescription. These medications come in various forms, including creams, ointments, suppositories, and oral tablets. Maintaining good hygiene, wearing breathable underwear, and avoiding douching can help prevent vaginal yeast infections. If you experience symptoms of a vaginal yeast infection, it is essential to consult a healthcare provider for proper diagnosis and treatment. Section 8. When to see a doctor seeking professional medical advice. While candidiasis can often be managed with over-the-counter treatments or home remedies, certain situations warrant seeking professional medical advice. If you experience any of the following, it is essential to consult a doctor promptly. If your symptoms are severe, persistent, or worsen despite treatment, it is crucial to seek medical attention. This may indicate a more complicated infection or an underlying medical condition that requires further evaluation and management. If you have a weakened immune system due to conditions like HIV, AIDS, cancer, or diabetes, it is crucial to consult a doctor at the first sign of candidiasis. Individuals with weakened immune systems are more susceptible to severe infections. If you are pregnant or breastfeeding and suspect you have candidiasis, it is essential to consult your doctor before starting any treatment. Some antifungal medications may not be safe to use during pregnancy or breastfeeding. If you have recurrent candidiasis, meaning you experience 4 or more infections within a year, it is crucial to consult a doctor to determine the underlying cause and discuss long-term management strategies. Recurrent infections may indicate an underlying medical condition or require a different approach to treatment. Section 9. Conclusion. Empowering yourself with knowledge about candidiasis. Candidiasis, a common fungal infection, can affect various parts of the body, causing discomfort and disrupting daily life. Understanding the causes, symptoms, and available treatments is crucial for effectively managing and preventing this infection. By adopting healthy habits, such as maintaining good hygiene, wearing breathable clothing, and incorporating preventive measures into daily routines, individuals can significantly reduce their risk of developing candidiasis. Seeking professional medical advice is crucial for proper diagnosis, treatment, and management, especially in cases of severe, persistent, or recurrent infections. Remember, knowledge is power when it comes to your health.